Brigadier, thank you. Really enjoyed that presentation. I've got two very quick questions. First one is, if I'm right, have I got this right? So this is a digital collation of ID on a central clouded database that's accessed in the field by the cellular network?
Yes, it's using a private SIM card for a private connection network to the central database.
Fantastic, thank you. And my second very quick question is, how do you identify non-UAE citizens?
Non-UAE citizens, yeah.
Yes, the database including all the visitors, residents, and locals. So even the visitors who come to UAE for visiting, their biometric information also included in the database.
Brilliant, thank you.
Okay, Phil?
So there is like real-time synchronization. Once they enter the airport for border crossing, their information is already transferred to the central database.
My question relates to the security. Obviously, it's very sensitive data here. Can you just explain your encryption standards for the solution you've developed?
So we are as an encryption, we are following the standards of 27,000 as the encryption standard. So we do and we follow this standard as well.
And we have information security policy to ensure all the security of all the information.
And one more thing, that every project will be implemented in our department. It should pass the security department, and this security department part of our general directorate.
Otin?
Yes, thanks for your presentation, very interesting. I have a question regarding deployment. You did say that for patients that had accidents, for example, they'll be transported to hospital and that identification will be sent to the hospital. Is this something that applies to all hospitals in UAE? Because obviously there are government hospitals and there are private hospitals. Are all hospitals, including private ones, all aligned to this system? And if so, how do you ensure security and management of data, patient data, if private hospitals have access to such sensitive details?
Yes, for patients, we have, let's say, an entity called National Ambulance, okay? And it is part of federal entity. And also it follows the security policy for the UAE government. Also we started now with public hospitals, and we have like a security standard. Before any integration between any hospital, they should fit with the security standard. Based on that, the integration will be completed. So we have like strict rules when we have any integration between any two entities. And also all the integration, we have something called FedNet, like Federal Network. So all the integration will be through the federal network.
Yes, this also includes the patient's data, the insurance data of the patient also. So all this is centralized in one database that we can use to ensure that all hospitals, when they receive the patient, they have the data they need about this patient, about his medical history, medical records, so they can take the immediate action and treatment based on what his kind of illness and allergies and so on.
Yes, and also his information will be only retrieved if there is like biometric captured in a live environment. So we cannot like use his ID number to retrieve his information. So he has to be there in the ambulance.
Okay. Thank you.
Okay, maybe you could just clarify again when was this deployed, please?
Again, please, question.
Can you just clarify when this was actually deployed and became operational?
It was implemented at the beginning. It's in 2022, and then we start as a project, actually a pilot project, and then we found out that this project can benefit us a lot, and then we extend the project to cover all UAE. So it starts in 2022. Sorry, 2021. Sorry.
Okay. And so this is being used on how many cases by now, or how many? Because I think in the application it says maybe about.
Yes,
10?
I think we have the statistics.
Yeah.
It is in the
In the
presentation.
presentation,
Yeah.
it can be shown.
Yeah.
Like in
Because I think it
each-
says about 10,000 at the moment, or something like that. Is that correct?
Yes, yes.
These 10,000 are only for the
Suspects.
final quarter of 2022. So it's the
Okay.
final quarter of 2022. Adding to that, the new enrollment of 2023 also, that's adds also to the number.
Okay. Okay, thank you. Do you have a question, Merrin, at all?
Yeah, I have just one quick question regarding to the. I would like to know about how do you measure the effectiveness of your initiative, and do you have any data on that?
Yes, we have KPIs. First, we monitor the usage of this application. Also, we let's say we have the KPI for the time taken to transfer the suspects from, let's say, from the field to the police station. And also we have the accuracy KPI to ensure there is no false acceptance or false rejection. So this will, affect the operation.
And how much the accuracy?
Now the accuracy with our partner, we make it around 99.5. So it's almost 100. And
All right.
Because we rely on iris recognition. That it is more accurate and it works day and night.
All right. Thank you very much. Thank you.
You're welcome.
We do have a small demo if you would allow us to demonstrate right now the system itself.
I'm sorry, I don't think we have time now. We're already running behind schedule at the moment.
No,
Right.
all right.
That's fine.
But very, very impressive best practice.
Sure. This is the device, actually. This is the device, and it can read the iris from any of our team here or any person.